Are you in an unusually sad mood? Loss of enjoyment and interest in activities that used to be enjoyable? Lack of energy and tiredness? Feeling worthless or feeling guilty, though not really at fault? Thinking often about death or wishing to be dead? Difficulty concentrating or making decisions? Moving more slowly or sometimes becoming agitated and unable to settle? Having sleeping difficulties or sometimes sleeping too much? Loss of interest in food or sometimes eating too much?
Roughly 20 million people in the United States suffer from depression every year. 1 in 4 adults will suffer from an episode of depression before the age of 24. Women are 2 times as likely to suffer from depression than men. People who are depressed are more prone to illness. Continuous exposure to violence, neglect, abuse, or poverty may make people more susceptible to depression. If you or someone you know are having at least 1 or more of these symptoms nearly every day for at least 2 weeks, you may be experiencing depression. But there is hope. Call your physician today and ask about Celexa. Celexa is a selective serotonin reuptake inhibitor. Selective serotonin reuptake inhibitors increase the amount of serotonin in your brain to improve the symptoms of depression by blocking the synaptic reuptake of serotonin, allowing more serotonin to stay at the junction of the neurons. Celexa is available in 10, 20, and 40 milligram tablets, costing from $7 to $11 per month, and is also available in oral solution. Some adverse side effects include nausea, headache, agitation, insomnia, anxiety, sexual dysfunction, serotonin syndrome, weight gain with long-term use. Suicidal tendencies can occur, especially during early stages of medication therapy. Follow a healthy diet and an exercise regimen.
Family and caregivers should look for suicidality, especially during early therapy or dose changes. Notify healthcare professional immediately if thoughts about suicide or dying, attempts to commit suicide, new or worse depression or anxiety, agitation or restlessness, panic attacks, insomnia, new or worse irritability, aggressiveness, acting on dangerous impulses, mania or other changes in mood or behavior, or if symptoms of serotonin syndrome occur.
This medication is not advised if you are pregnant, plan to become pregnant, or are breastfeeding. Please contact your doctor if you have any questions. Do not take this medication if you are currently taking any MAOI medications. It is important to encourage people to get appropriate professional help and treatment as early as possible. Remember, this illness can be disabling. Reach out for help today. You don't have to live with depression.